are you excited for your first day of your level 1 fieldwork?
Yeah.
So today we're going to start with administering the trail making test. Have you heard of this before?
Nope, that's completely new to me.
Well, it's a really great screening tool. It assesses for cognitive functioning, particularly executive functioning, sequencing, visual motor skills, and the ability to switch between tasks. But it can be used with clients who have Alzheimer's or dementia to see where they're at, as well as clients with a traumatic brain injury, or even individuals who have a mental illness such as schizophrenia or depression, because oftentimes that can affect your cognitive functioning as well. So do you have any questions for me before we go into the client's room?
How are you going to set this up?
I'm going to set it up so that there's great lighting for the client, and I want them to be seated so that their feet can be grounded, because when their feet are grounded, they'll be able to focus the best. And I also want to make sure that if they have any visual impairments, that this is corrected before beginning the test. So if they need glasses or contacts, that they're wearing them to begin the test. The test consists of two parts, Part A and Part B. Part A, as shown here, has the client connect numbers chronologically. They'll go from number 1 to 2 until they reach the end, and they cannot lift their pencil until they're complete. Part B has the client connect numbers and letters chronologically. They'll go from 1 to A, 2 to B, and so on until they reach the end. Again, they cannot lift their pencil until they reach the end. They will be timed for the test, and their score is represented by the time of completion of the task. Come in. Hi, Darcy.
Hi.
My name's Elizabeth. I'm going to be your occupational therapist today. How are you?
Good, how are you?
I'm good. This is Kara, and she's a student. Do you care if she observes?
No, that's fine.
All right, great. Today we're going to play a little game, basically. It's like connect the dots. It's called the trail making test.
Okay.
So, is that okay with you?
That's fine.
All right, so first I'll show you how it works, and we'll do a practice round, and then we'll do it for real.
Okay.
So what we're going to do is you're going to connect the dots from 1 to 2, 2 to 3, 3 to 4, until you reach the end. And what you want to do is not lift your pencil off the paper and do it as quickly as possible. Okay? So I'm going to give you this pencil.
Okay.
And you can just try it out and take your time whenever you're ready to start.
Okay.
So now we can do the real version. It's going to be basically the same thing. You're going to connect the dots from 1 to 2, 2 to 3, and so on until you reach the end. And you want to go as quick as you can without lifting your pencil off the paper. And this time I'm going to time you, okay?
Okay.
Ready? Begin. Great job. Now we're going to do part B. And it's a little bit different because it has numbers and letters. So you're going to start with number 1 and then go to A. Then go to number 2 and then B and so on. Sound good?
Okay.
All right, so whenever you're ready, you can begin. And again, you don't want to lift your pencil off the paper.
Okay. Okay.
All right. So that was the practice, and now we're going to do the actual. So this time I'll time you, but don't feel pressured. And now you're going to go from 1 to A, 2 to B, and so on until you reach the end. So this just has more numbers and letters on it. Okay?
Okay.
So whenever you're ready, you can begin.
Okay.
All right, great job. So do you have any questions about the test that was just administered?
Yeah, I was kind of wondering what would happen if Darcy had lifted her pencil or skipped a number or letter or made another error.
That's a really good question. So if that had happened, I would have corrected Darcy, but she would have kept going. I wouldn't have stopped the clock at all, so this would have been added to her time and decreased her results on the trail making test.
Okay. So I'm still not sure I entirely understand how this test really fits for the OT process and treatment. It just seems like it's connecting dots and letters, and I just don't understand how it fits in.
That's a great question. I'm actually going to have you go and research that for next week. So go back and research it, and when you come back next week, you and I can talk about it. And I'd also recommend that when you are researching it to go and look at some research articles that talk about the reliability and validity of the assessment, and we can talk about it together.
Okay.
All right, and if you have any questions, we'll definitely talk about everything. I just think it's a good idea for you to research it a little bit on your own before we delve into it.
Okay, sounds great.
All right.
Worst fieldwork educator ever.
Hi, Kara. Did you have a good weekend?
I did have a good weekend. How about you?
I did, thank you. Were you able to look into how the trail making test can be applied in the OT process?
I did get a chance. I learned that it can be used early on in the OT process with other evaluation tools to get a picture of cognitive functioning important for tasks such as driving. Also, I learned that it can be used throughout the OT process to assess cognitive change, and it's important in intervention to know where a client is at cognitively so that you can apply the Just Right challenge.
That's great, Kara. Did you learn anything specifically about how the trail making test can impact treatment?
I learned that you can find out a lot about a client's processing skills, such as attention, sequencing, terminating, searching, and locating. Also, you can learn a lot about a client's visual motor skills. They'll be manipulating a pencil and integrating their motor movements with the visual input they see in the test forms. Based on an individual's performance on the trail making test, you can develop a plan and make recommendations so that you consider a client's safety. Maybe you'll have to modify tasks and help them find strategies to improve their cognition.
These are all definitely things that I utilize, especially from working with Darcy. I'll take all of these aspects into consideration to formulate her treatment plan. Did you learn anything about the psychometric properties of the test?
Yes, I found out that TMT raw scores can be considered on their own, but the test is also norm referenced, and norms are often stratified by age, gender, and education level. The inter-rater reliability of the TMT is very strong as the test is so easy and clear to administer. The test-retest reliability may be affected by practice effects if a client is used to taking the test and if the test is administered in periods of less than 6 months apart. However, overall, the test-retest reliability is strong.
You could teach me something about this test, Kara. Did you see anything about the validity of the test?
I did. In regards to convergent validity, other neuropsychological tests may predict aspects of TMT scores, as seen by regression and correlation analyses. Also, in regards to discriminant validity, the test is effective in discriminating atypical cognition from typical cognition, and sometimes the TMT scores may predict functional outcomes.
That's all really interesting. You really taught me a lot just now. So now that you've researched the test, I just want to tell you some of the reasons that I use it in practice. It's really easy to score because it's simply based on time, and it can be used with a variety of clients with different diagnoses. So it can be used with clients who could potentially have Alzheimer's or dementia, clients with an acquired brain injury, such as a traumatic brain injury, depending on the severity of it, and also clients with other mental illnesses, such as bipolar, schizophrenia, or depression, because having a mental illness can impact your cognitive function as well. Additionally, the test requires no training. So if I need my occupational therapy assistant to administer the test, I can have her do so. And also the test is quick, so I can use it as a screening tool throughout the intervention process, as you saw, and just to see where my client's at and if they're progressing with treatment.
So are there any weaknesses?
Yeah, were you able to pinpoint any out when you watched me give Darcy the test or during your research?
Well, it doesn't seem very occupation-based. Also, the test can find broad cognitive dysfunction. However, slow performance in the TMT may be due to different factors such as visual scanning difficulty, incoordination, or conceptual confusion. So it may not be very specific about pinpointing cognitive difficulty.
Right, that's a very good point.
Also, if you had visual deficits or trouble moving your upper extremities, completing the test would be hard. However, completing the test via visual tracking has been researched.
Exactly. Way to modify and adapt the activity.
Right.
Also, another thing to point out too is that the norm reference scores are based on healthy individuals without a cognitive impairment, most likely. So it's hard to compare if you're testing an individual who potentially does have a cognitive impairment. And then before we talked about the practice effects that are there. So if I'm assessing an individual throughout treatment and giving them this test again, if they're familiar with the test, it might skew their scores because they might do better as a result of their familiarity.